Let's continue. The ST segments are transient elevated, resolves of the pain. Now remember, concumbus clusters. Key point, the cardiac enzymes are negative. It rules out what, please? Myocardial infarction. What are the two types that you should know? Once again, if it's transmural, you tell me what kind of blood vessel, artery or arteriole. And I'm hearing artery. Excellent. So that would be transmural, that would be an ST elevation. Whereas if it was arteriole, then it would be a subendocardial MI, and it would be a non-STEMI. Maybe perhaps you find a ST depression, but the cardiac enzymes there would be positive. Here, typically negative, as they would be in almost all types of angina. Let's continue. What did we say about the narrowing? Would you find narrowing if the coronary arteries are undergoing a type of blundering effect? No. The catheterization and your angiography would find normal caliber of your coronary arteries. Now, the definitive diagnosis, what do? Induction of vasospasms during the angiographies. At least keep that concept in mind, because you're not going to find actual blockage. Now, important here, be careful. So what exactly are you trying to control? You're trying to control that vasospasm, aren't you? And let's make sure that we go back to our biochemistry and physio here to make sure that we can lead up into why calcium channel blockers are so important. Remember, please, when we're doing our medicine here, it's the fact that our foundation has to be strong, and you could get questions on the foundation, meaning physio and biochem, and then, of course, dealing with pharm or pathology. So here, if you're thinking about calcium, what kind of muscle is blood vessel? Smooth muscle. Good. Involuntary or voluntary? Obviously involuntary. You don't have to tell your blood vessels, please contract. That doesn't make any sense. Next, you're thinking about calcium calmodulin, aren't you? You should be thinking about alpha-1, aren't you? And when you do so, that calcium then brings about what can affect on your blood vessel, on smooth muscle, contraction. The blood vessel causes vasoconstriction. So therefore, what are we trying to do here with vasospastic? It's already in spasm. Let's try to relax it. So if you're trying to relax it, what might you want to do with your calcium? Why not try to block the effects of calcium? And by doing so, you're relaxing the blood vessel, diastase. Now be careful, you do not want to use beta blockers. Is that clear? Once again, beta blockers will be contraindicated in vasospastic disease. Be careful. Now, in addition, you also want to bring about relaxation. That's the bottom line. Isosorbide mononitrate. And that is a long-acting type of, well, take a look at the name here. The operative word, nitrate. What does that mean to you? Relaxation of your blood vessels, period. Management. Well, there's another one. It's called phosphodil, or kinase inhibitor to prevent the release of acetylcholine-induced vasospasm. Once again, the objective with vasospastic is to do what? To make sure that you try to induce relaxation as much as possible.